We're a kind of a dual unit. We have both intermediate care step-down beds, and we also have a clinical decision unit. We have 8 intermediate beds, and that gives us about 15 or so observation beds. So we get to see a lot of different types of patients, different patient acuities. The observation side is trying to make sure that patients don't have to be here too long if they're not sick enough. Gives the doctors about 24-48 hours to run some tests that it will take too long for them to do in the ER. We, do a lot of communicating with other departments in the hospital to try to expedite patients getting out of here and build a good rapport with those departments and physicians to be able to get patients what they need to be able to go home quicker. So usually we get there in the morning and we have a huddle so that everybody's aware who has lines, who may be a falls risk, who has Foley's, and so on and so forth. And then of course we get out to taking care of our patients and assessing them and doing our medication passes and so on and so forth. We have rounds at the bedside. We don't go into a conference room and do discharge planning. We actually do it at the bedside with the social worker and the nurse manager and the RN who's taking care of that patient. So on the intermediate side, we have 3 patients apiece. They are relatively sick. They usually come either to us from the ICU or sometimes up from the ER that aren't quite sick enough to be in the ICU. We get all types of different, types of patients. We get, anything from GI bleeds to ventilated patients and anything in between. So I'm still learning every day on the job. It's been fun for me.